Okay, great. So again, thank you. Again, I'm from Michigan State, College of Nursing back in the thumb, if you over in this area from that standpoint. So today, again, I'm just going to focus on providing an overview of a qualitative study that I conducted with my research colleagues and mentors. So let me move this forward. There we go. So I just wanted to thank those that provided their time and support for this work. And then again, with our funding sources for the study. So here's just a brief overview of my presentation today. This study was part of a larger quantitative study where we identified some gaps that required some qualitative work. So I'm going to introduce some key concepts that were included in this study and then discuss the conceptual and adapted models that were used to guide this work. So as you can see, children with developmental disabilities are at high risk for health problems than children without disabilities and often have co-occurring chronic conditions that are compounded by challenges with communication, and that may contribute to undiagnosed conditions. So families of children with developmental disabilities usually face greater caregiving demands and often interact with a wide range of service providers to support their needs. The research has demonstrated the importance of family adaptation to optimize management of a child's disability, but yet often families experience, high levels of perceived stress and caregiving challenges. So research has documented that parents that that are highly stressed are less likely to implement interventions for their children with disabilities, and then they can make less progress. So really, it's important to understand those factors that empower and support families to adapt and cope with continual changing demands that lead to better health outcomes. So as you know, I'm a nurse, and so nurses and our colleagues, our interdisciplinary professionals, are really pivotal in assessing and supporting our families for successful outcomes. There we go. So as you can see, the rates of children with developmental disabilities in the US in the last decade have increased along with their life expectancies. Developmental disabilities have lifelong implications, not only for an individual, but for families as well. And communication is really a critical aspect of adolescent development. And when communication is compromised, many face barriers or limitations to some aspects in their life. So adolescents and children with complex communication needs are really challenged to communicate effectively using speech alone. You can see here in the US, there's close to 1 million children that have complex communication needs, and that really refers to, as we go through the presentation, a gap in one's need to communicate and one's actual ability to communicate. So maybe they're thinking those things, but it's not coming and articulating in the way that they would like. So technology use such as augmentative and alternative communication, and I'll refer to that in the presentation as AAC, is really an emerging area to assist children with complex communication needs, but it does require adaptation and family assistance in that regards. So here's just some examples of AAC, or I'll go through some examples, but AAC is really pictures and symbols, or maybe use of computers and iPads, apps, speech generating devices. The device options are usually dependent on the child's needs and their abilities, their communication function, where they are with that, and their age appropriateness. And they can be used in a wide range of activities. Forms of AAC generally exist in different realms of tools, but in this presentation, we're going to refer to that as low technology, mid, and high. And I'll just give you a few examples of what that looks like so you have some context. So low technology usually refers to like no battery types of components, usually a communication board. We call it a PEC system. In mid technology, you can see here a little bit of an upgrade, usually battery component from that standpoint. And then you can see the high tech usually involves like the iPad, speech generating devices, iDevices with apps. And usually the speech generating devices are where phrases and messages are spoken within a voice synthesizer. And now that technology is getting better, that's usually an opportunity to, change what that sounds like depending on the individual. So what's the significance? So really, families of children with developmental disabilities may be at risk for maladaptation amid their family system with the implementation of AAC technology. So really, we're trying to get at, why do some families adapt, others don't? There's really a limited understanding of that in the family focused science and practice and outcomes. So usually the implementation of the AAC devices have been centered around assisting the child and not so much within the family. So it's really important to understand that complex role and how they intersect for successful outcomes. So in talking about the study, just wanted to give you just a brief overview about the conceptual underpinnings. So in this study, this model was used to guide our work, and this is the resiliency model of family stress adjustment and adaptation by the McCubbins and Ann Thompson. So it utilizes a family systems approach, emphasizing and combines both family stress and resiliency model, and it makes up the components. So in the regards to the key outcomes in these pieces, these were some of the things that we were looking at in our study to understand the outcome of adaptation. And here's just the adapted model from the state of the science, areas that needed to be examined for this qualitative study. So in regards to moving forward with what our research question and aim was for the study, you can see the aim here in that regards. Our research question was really addressing, we were trying to look at and understand parents' perceptions of the key interacting components. So in the model, the family demands that they have, the types of families that they may be in that regards, appraisal, looking at their resources and their problem solving and coping. And that's really association with family adaptation when that adolescent with a developmental disability uses an AAC device. So now we'll talk a little bit about our methods. So in that regards, we sampled, we were looking for parents or mothers, fathers, primary caregivers in that regards, legal guardians of adolescents aged 13 to 18. We recruited them to participate in our study. A family was really defined as a unit of at least one parent and an adolescent with a developmental disability, and parents were the respondents for the family. Our inclusion criteria, you can see here, we were looking to work with families that had children with autism and or Down syndrome, using an AAC device, as we kind of talked about already. And then they had to have internet access, and we'll talk a little bit about that as we move forward. Our recruitment strategies, we recruited online through Research Match, DS Connect, and then through internet space, as far as support organizations for like Apraxia Kids, Autism Society, in those regards. And then if you didn't know, the Research Match and DS Connect are nationwide online volunteer registries, and they're supported by the NIH. So that was a really nice opportunity for recruitment. So we utilized a Qualtrics survey, the online link for families to participate. Obviously, we had some informed consent and IRB regards there. And then the participants who volunteered for the interview, we did that via Zoom. And then after the interview, we thanked our participants for their participation as well, for working with us in their time and their effort that they spent. So as you can see here, our data collection, we talked a little bit, the study utilized semi-structured interviews to investigate the experiences and perceptions of the parents of adolescents using AAC. So we used a demographic questionnaire for parents to fill out to kind of obtain information about their parental and adolescent characteristics. And we also utilized a qualitative guide to help us in regards to looking at the model components that we discussed. So here's just a snapshot of some of the data that we collected. Some of the parent characteristics and adolescent characteristics. One that you may not be familiar with is the communication function. And we used the communication function classification system, the CFCS, and that helped us understand where the adolescent was with their functioning. Usually they have 5 levels within this tool, and level 1 is the best functioning from that standpoint. And then level 5, usually the adolescent or the children will have the most difficulty with communication. So here you can see our data analysis. We use descriptive analysis to collect and describe the adolescents and their families and their characteristics. We also utilize professional transcription for our interview data. We also did member checking. So once we gathered the data, we sent it to parents to give us some feedback to make sure we synthesized and captured their voices. And we also utilized 2 reviewers to help code and use the for the thematic analysis and process with the coding and the themes. So our results, so here's a snapshot of our parent participants in the study. So although the interviews were open to all parents, no dads decided to volunteer for this one. We had about 66 parents that really expressed interest and consented to participate in the interview, but we only had a total of 8 parents that complete it. So about a 12% response rate. And definitely this could have been influenced because we did data collection during my dissertation during the pandemic, unfortunately. So, and it was a holiday time too as well, even though we tried to recruit as best as we could. So here you can see our adolescent participants. So again, we primarily had males in our sample. We had about a 50-50 split between the primary diagnosis of autism and Down syndrome, and our communication level for our adolescents was in the range of 3 to 4. We primarily had individuals using high technology, and you can see that our mean age was about 15 for our adolescents. Sorry, I'm having trouble with my mouse. There we go. So here are our qualitative themes, and they're grouped by our family adaptation components that you can see there on the left. And really, these are kind of, like I said, the themes were nested within the components of the model. And the results of the analysis really captured the specific areas of importance perceived by the families and the adolescents to promote AAC adaptation and enhance our understanding of the model components. This analysis really kind of underscores the importance of supporting families and their needs, and especially during adolescence. This has been really sparse in the literature. Seems like we do a wonderful job helping out with our younger individuals, but as they age, sometimes the services tend to be a little bit sparse. So as we look at our data in that regards, you can see that through the next couple slides, we're going to go over the themes and sub-themes and some key quotes you can see here. But really, the first theme that we looked at was the contextual strains and influences. And most of these pieces that we found were supported from prior literature and studies that we found. Obviously adolescents can have some challenging behaviors and attitudes. There were some technology challenges and some limitations. There was some lack of time and training with the AAC, challenges with financial concerns and how to pay for some of these things, getting insurance to help support those. As well as, some limitations in support of feeling isolated in society in that regards, and little awareness about AAC and what that looks like in the day-to-day basis. But some new areas presented, and that was in regards to the integration of AAC into classrooms and some of the design for the AAC devices. We're working with adolescents and thinking about, what's appealing to them. Do they want a big iPad to carry around, or should it be something of a technology integration? An iPhone, maybe it looks a little bit different, but something that kind of helps them fit into their adolescent time period from that standpoint. And they also noticed that sometimes a lack of supportive public policies in regards to the technology pieces. So they found that sometimes in different school districts, there was some different rules in regards to the AAC use and devices. Another theme that we found was with the families was person-first approach, and that really included advocacy and inclusion. The families really illustrated the fact that if they have some collaborative and empowering approaches, that really focuses on the strengths and can be meaningful for inclusion for their adolescent and their family moving forward. Also, AAC led to opening doors. That was another piece that we found, or another theme. And it really recognized AAC as a positive tool for their family. They really perceived that this instrument could help the student or help the adolescent increase their quality of life. It supported their language and their literacy development and their communication competence, and also, increase their social connections. So students that had an iPad or some kind of device, they drew other students to them to take a look at that, and they thought it was interesting. So that helped them with increase those social connections and opportunities for the future. The parents also perceived, some negative perceptions regarding the device, worrying about managing for the future. What is that going to look like for their next steps and challenges with employment, health, housing, and potentially, legal concerns moving forward. Let's see here. Oops, I think I'm behind a little bit on some of these. Sorry, it looks like I went the wrong way. Okay. Facilitators. Another area that we found facilitators for support was in regards to family routines and informational support. So the more information the families were able to gather in that regards, it seemed like that was helping them to adapt and integrate. They also felt very positive about sometimes their child's traits really, and their interests and personalities help to improve that device utilization. So one of the families, I thought this was really, she has the memory of an elephant. She knows more about that screen than that's in the computer and her iPad than I do. So really some of the characteristics of individuals, I know my son has an intellectual and developmental disability and communication impairment, and he has a great memory too. So all those technology pieces come into play, and that really helped them integrate some of those opportunities for the integration of the technology. And then another theme that parents came up with from the study was the planning is key. And so really considering that parents kind of are trying to seek out information that help them try to adapt, to integrate with other families, looking at opportunities to collaborate with other professionals and how they could make things better for their individual planning in the future. And again, many of the parents orchestrated the fact that they were concerned about their child's future and what that looks like moving forward, not only for, school, but for transitions to health and transitions into life as well. So some of our conclusions and implications. So there are a lot of findings in the study that were supported by previous research, but some of the new discoveries and factors that we thought shaped family adaptation in the study were found and just added a different perspective from the parents and the things that really the topics that mattered to them. And like I said, one of the things that really mattered was the technology design in regards to what's something that could be a little bit more appealing to an adolescent, so that they could feel like they can fit into their social range from that. And I think the study really lays the foundation for the development of future interventions by identifying modifiable components. So we talked about each of those areas and those themes, and can we change, the resources? Can we change some of the problem solving pieces in regards to helping vulnerable families adjust and integrate? So of course, with any study, there are limitations, and some of ours, as you know, oops, were in regards to our sample size. Also, we worked with families that had internet access, so that limited some of the inclusion as well. And then again, I think as far as the diversity of our participants, that would have been another opportunity to help with generalizing our findings. And then something that would be nice to in the future was understanding adolescents' perspective. So we have the parent perspectives, but adding that would be a helpful piece too as well. So again, implications for practice, just thinking about advocacy for nursing competency, as well as competency with other interdisciplinary professionals with the use of AAC technologies to really care for families and individuals with disabilities. I know in our nursing program, we don't typically have these opportunities for students in every clinical site. So looking at opportunities to work with individuals and families that have different abilities and strengths to integrate some of these things into our practices, and really our practices keeping pace with technology. So if these are devices are being used, then how can we work with the patients and the families to integrate that into how we care and practice every day? Our policy pieces, just kind of looking at reducing some of the barriers. I kind of talked a little bit. Families have issues with insurance and understanding, different rules in different school districts for different types of assistive devices and what that looks like. So trying to advocate for reducing those, and then also increasing societal and, like, again, interdisciplinary healthcare professionals to really be aware of the support needs that families need to be successful for not only when they're young, but when they're an adolescent, and then that transition period that is so important to move forward. So just wrapping up here, again, I think the study offers a novel approach to examining sometimes neglected concepts that are relative to families and how they adapt to technology. It really extends the understanding of the components of the model and how can we move through some of those to create some interventions. And again, provides a foundation for some interdisciplinary research. I work with a team over in human development and family studies, special education, as well as technology and speech and language. And so it's really been a really rich opportunity to work with others. So again, I just wanted to thank you for your time today as being the last slot for the day. And I appreciate your attention. And there's my contact information if you have questions or concerns. So thank you.